So good afternoon, everyone. Before we start our official COVID briefing today, I cannot go without acknowledging the devastating news coming from the community of St. Lawrence. These past few days have been heartbreaking for this community and indeed for all our province. First was the news of an overdue fishing vessel on Monday evening, and yesterday we heard the news of 3 men who recovered from sea. And we know that the search efforts will continue and are currently underway for the 4th missing person. So to the families and friends of those lost, 3 of which were from one family, please know that we share your grief and our thoughts are with you during this difficult time. The sea has provided a livelihood for many families in our province. And Newfoundlanders and Labradorians, we love the ocean. But we also know it can be powerful, can be graceful and merciless, all at the same time. And we also know that it's forced all too well as the sea has claimed the lives of so many Newfoundlanders and Labradorians. So on behalf of our all-party committee who met again this morning and all Newfoundlanders and Labradorians, we send you our deepest condolences. For now, I will now pass it over to Dr. Fitzgerald for our daily update.
Thank you, Premier. Good afternoon, everyone, and thank you for joining us today. Since the media advisory yesterday, we have no new cases in the province, and our total number stands and remains at 260. 1 person is in hospital due to the virus, and 255 people have now recovered, and in total we have tested 11,617 people. Thanks to our significant individual and collective efforts, we are on a solid trajectory for living with COVID-19. For the foreseeable future, until a vaccine becomes available. And while we only have a couple of confirmed active cases right now, I really can't overemphasize the importance of staying the course by continuing to adhere to the public orders in place. Our success in flattening the first wave of this virus is because we took swift action to control its transmission. And had this virus spread widely, it would have most certainly stressed our healthcare system and taken more lives, as we have seen elsewhere in the world. Experts around the world are predicting a second wave of COVID-19, and we must remain vigilant in following the public health measures in place so that when it happens, we will be in the best possible position to respond. We are still learning much about this virus, and evidence clearly shows that proper hand hygiene and physical distancing are 2 of the most effective ways to prevent its transmission, and we all have a role to play in this regard. So please continue to stay home as much as possible, especially if you feel unwell. Remain at least 2 arms lengths from others when in public spaces. Cover your coughs and sneezes, and wash your hands often and well. Our diligence in maintaining these actions will have a significant impact on how COVID-19 advances in our province in the coming weeks and months. I know we are all very eager to resume our lives, but as long as COVID-19 is a risk in our population, it is imperative we act with caution and care to avoid undermining the accomplishments we have each personally sacrificed so much to achieve. As we prepare to move into Alert Level 3 in the coming days, I would like to advise that today guidance related to the reopening of campgrounds and personal service establishments such as hair salons, barbershops, spa and aesthetic services, and tattoo parlors is now available under the Business and Employees section of our provincial COVID-19 website. Please visit gov.nl.ca/COVID-19 for more information. Guidance related to the use of outdoor tennis courts is also now available online. This website is updated regularly, and I encourage you to visit it daily for the most accurate and up-to-date information about COVID-19 in our province. As a recap, for those who may have just joined, we have no new cases since yesterday's media advisory, and the total number of cases in the province remains at 260. When COVID-19 first hit our province, the situation was frightening and the outlook was uncertain. And yet, here we are today, still standing strong and united together, albeit from a distance. I am proud of the magnitude of what we have already accomplished together during this very difficult time, and I hope you are as well. We know this virus will be with us for a while, and there will be challenges ahead, but I'm confident by the actions we have shown to date that we will do what it takes to persevere and adapt when necessary to reach the end of this pandemic together. Hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. Well, it's another good day of news to report. That's 20 straight days of no new cases of COVID in our province. So thank you again, everyone, for your efforts in following the public health measures that's been put in place by Dr. Fitzgerald and our health officials. We all know they put them in place for your protection. So it is by working together that we will continue to see results like we've seen over the last 20 days. As Dr. Fitzgerald just mentioned, we are less than 2 weeks away from moving into Alert Level 3. But let's remain cautious in our approach so that we continue to move forward in a safe and a reasonable manner. The more we put a blanket over this virus, the better success that we will have in the future. So as we move forward into our new normal, you are seeing a change in many areas of our life. Dr. Fitzgerald just mentioned some changes that we will see as we move into Alert Level 3, but earlier today, we announced that we are reinstating family visitation for children and youth in care. So we recognize the importance of nurturing and supporting relationships, facilitating the bonding and the attachment between parents and their children, and also about promoting cultural and community connections. So we do this by working directly with families. We have begun developing plans. Some cases, it's case by case, it's specific for each family situation, and making sure it is physically safe to do so. So decisions such as those are made in consultation with the expertise of the Chief Medical Officer of Health, as we recognize that safety of our children, youth, and families and caregivers are important before these decisions are made. So we are looking, so if you're looking for information about what I've just spoke about, you can call the department who is responsible for this, the Department of Children, Seniors, and Social Development. And the toll-free number there is 1-833-552-2368. Also, speaking of families, they have been through a lot during this pandemic, and we recognize that. But there is one group in our population that we can draw some inspiration, some positivity, and energy from. That's our youth. And they have been adapting to a new normal, and they have been seen, and this can be seen through their creativity on social media. They have shared videos, personal videos, on their virtual grad celebrations. They've written songs. They've shared their hobbies. And in a lot of ways, they are teaching us. Now, every day we meet with industry. We meet with various organizations and groups as we continue to put supports and resources in place as we get through this tough time in our history. But we are also focused on moving forward to our new normal. And one of the groups that I continue to meet with is the Premier's Youth Council. These are a group of talented and vibrant youth spanning across all parts of our province. We have youth from Forto in Labrador to Grossmorn to St. John's and all communities in between. Now, during our last meeting, we discussed many issues that are important to them. And they told me about a project that they are working on, about a message that they wanted to share with you, Newfoundland and Labrador. They wanted to acknowledge the important role that our youth have played in response to the challenges of this pandemic. So what they did is they created a video. It was written, it was directed, it was edited by the Premier's Youth Council. So given there are thousands of families who are watching this briefing right now, we thought it would be great if we could share it with you. Now, without totally giving it away and what it's all about, it shares their story about how we stand together, making the most of life with COVID, and helping each other adjust to what is a new normal. So we now take a few seconds and share this video with you. Youth of Newfoundland and Labrador are resilient and inspiring. Your willingness to adapt and overcome the challenges caused by the COVID-19 pandemic is appreciated, it's needed, and frankly, it's motivating. Your passion for our province and the solid grasp of the issues that we face is further proof that this province will be in good hands for many years to come. So thank you for all that you do and continue to do as we prepare for living life with COVID-19.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Our new normal is affecting many things.
My graduation.
My mental health. My job.
My vacation.
My time with friends.
My sports.
My school.
My volunteering.
This has brought us together as a community of Newfoundlanders and Labradorians, and taught us some very special things.
To rediscover old passions.
To reconnect with old friends.
To enjoy the company of family.
To challenge yourself to try new things.
To practice self-care.
To slow down.
To appreciate the little things.
We want to thank you, the youth of Newfoundland and Labrador, for all you are doing. We wouldn't be able to move forward without you.
You are helping Newfoundland and Labrador stand together.
So I got the opportunity to work with this group of young people on a regular basis, and you can see, as I've already known, that the future of Newfoundland and Labrador is in extremely good hands. So I want to thank the members of the Youth Council for creating and sharing this important message for you. You have sent us a message. The message is one of optimism. And we are in this together, and let's continue to work through this together. Now, if we stick with the topic of youth for a few minutes, we have a new web page added to our COVID website that is specifically targeted at youth. And this web page is designed exclusively for ages 13 to 17-year-old audience in mind. So as we approach level 3, and as the weather gets a bit nicer and we recognize our younger population will be more active outside and coming in contact with their friends. But we also know that this age group, this young age group, well, they have their own questions as well. They're no different than adults. Their mental health is being challenged during the pandemic. So it's not easy when you're at this age and you can't hang out in person with your friends. So with that in mind, the Premier's Youth Council, members that I've just shown you there, and Thrive, which is a great organization in Newfoundland and Labrador, they got to work and created a page to make sure it speaks to the age group and it resonates to them. So by adding this youth web page to our COVID website, young people throughout our province can now access information in a way that speaks to them. Social media allows us a particular avenue to reach this young age group, and we're working with platforms that are targeted to this very age. So the platforms that you would see or would be, that I mentioned here, will be things like Snapchat, TikTok, YouTube, Instagram, and of course video games. We know they own these platforms. This is an opportunity to catch their attention and with some quirky and yet fun information in their home turf. So once again, Newfoundland and Labrador is leading the way as we're among one of the first provinces in Canada to specifically recognize this age group, and we've done so by customizing a website specifically for them. So with information on mental health during the pandemic scattered all over the internet, finding accurate information and appropriate resources can be difficult and confusing. That's why we've been pointing you towards the trusted websites like the COVID website and Bridge the Gap. And now we have a youth page to add to that mix. So if there's a message I think that we all send from this province and this panel and this table, is that remember that you are not alone. You're simply just a click away, so don't forget to take care of yourself as we work through this together. Now, before I pass it over to the Minister today, I want to update you on the business response team. So right now, this is a group that are working in conjunction with businesses and community organizations in their plans to reopen in our economy. So right now, we have about 91% of the inquiries that has been into them. They are now complete. There's been 910 inquiries, and there's currently only about 40 to be worked on. And so you can see they're doing some great work in getting through what's been a considerable task. So some of the common themes that we're seeing are questions around restaurants, camping, salons, and accommodations. So this should give you some good indication of the work that's being done in conjunction with public health and this business response team. And again, tomorrow afternoon, we will put a news release issued to provide you with the latest information of COVID, tomorrow being Thursday, of course. And on Friday, Dr. Proton Raman will join us for a briefing. He's been with us before, as you know. He's joined us to provide updates on modeling and scenarios in our province. We know him as a clinician scientist at Eastern Health and a professor of medicine at Memorial University, but he also leads the core analytics team for our group. So he's becoming a familiar face around this table, and we're looking forward to his presentation on Friday of this week, the next time we come to you during this at such a media availability. So with that said, in the meantime, I will now pass it over to the Minister, who is joining us remotely today.
Thank you very much, Premier, and indeed it is a sad day in St. Lawrence. We've been thinking about you, and I'd like to add my condolences to those of the Premier. I mean, the sea indeed is a cruel taskmaster sometimes. I thought my remarks today, apart from, again, congratulate everybody on holding the line and holding fast, as Dr. Fitzgerald would have said, would be to add some context around the other unfolding sad news from Ontario around long-term care and seniors care, and to reflect on how our system here in Newfoundland and Labrador is different, significantly different. In my previous life, I had the opportunity to work in two long-term care facilities, one in Gander here and one also around the Loop in Brookfield at Bonnews. And what I have to say is I saw well looked after staff and well looked after patients, happy staff and happy residents. And I think set against that background, there's always things we would like to look at to make better still. But from the point of view of how our system is organized for residential care for seniors, I think it's important to point out there are two principal elements. There are what we refer to as long-term care facilities. These are run by and operated by the regional health authorities, essentially in the same way as a hospital would be. These are accredited, fully accredited by Accreditations Canada. They're inspected on a regular basis. They fall under our new piece of legislation around the Patient Safety Act and reporting of adverse or untoward events. And so the level of oversight there is really no different than you'd see on an acute surgical ward or an intensive care unit. We have, during COVID, because of the restrictions around visiting, again, done to protect the most vulnerable of our elderly. We have made sure that allied health professionals and recreational therapy staff have actually been on-site providing hands-on services in addition to the nursing care that the residents will get. And that, I think, has helped take some of the sting out for the residents in terms of social interaction and the challenges presented by having to put in place very difficult restrictions. They were difficult for us to put in place, and I know they've been a challenge for families and residents alike. We have gone a long way with those who are able to use things like iPads, and I think, indeed, the seniors advocate referenced that in her media earlier on today, and it's a source of some pride that we got there that quickly. Obviously, there's always room for improvement there. The other piece around residential care for seniors are personal care homes. These are privately run establishments with beds which the department will subsidise to a greater or lesser extent for people with income challenges and care needs as well. These are licensed by the regional health authorities, and they are inspected on a regular basis by the regional health authorities. Indeed, over the last 6-month period for which I have data, which spans October through to the end of March, the 87 homes we have in the province had no fewer than 1,400 visits, either announced or unannounced, to monitor. These were not related to care. These were purely monitoring visits. In addition to that, you'd have clinicians, such as myself in my former days, visiting, as well as community nurses, wound care nurses, and this kind of thing. So these visits are both, monitoring visits are both announced and unannounced. So there is a significant level of oversight. And in April, mid-April, our department wrote to the RHAs to make sure that this became and was maintained as a priority for them in terms of helping the PCHs, the personal care homes, through a difficult period. We have, again, looking at the challenges in Ontario around personal protective equipment, about infection prevention and control advice. We've been very keen to make sure that gap wasn't here, and we have required each personal care home to submit a formal written pandemic plan detailing how they would manage infection and prevention measures. We have supplied them and been supplying them with masks, for example, for their employees for a period of at least 5 or 6 weeks. So I think I want people to draw some comfort from that, given the news that's come out. It certainly is an eye-opener for all of us, and it certainly is one of those moments where we will pause and we will reflect and see what lessons we need to learn from that. But I think it was important to reassure families, particularly with the challenges they've had around visiting, that the situation here is significantly different. That was really the bulk of my comments today. I believe it may actually be Dr. Fitzgerald's birthday, so congratulations. I haven't had the chance to mention that yet today. I'm in my bubble here, and she's in hers as well. So I would encourage everyone to stay in their own bubble, double as though they may be. Protect your bubble, respect everybody else's. And I think if we can continue to hold the line, then we're certainly on track for moving to alert level 3 next week. So with that, Premier, I'll hand the event back to yourself.
Thank you, Minister, and I guess I should join what will be a long parade of recognition and well wishes and happy birthday messages to Dr. Fitzgerald today. And I can tell you, I will leave it there, as I know that keeping ages, is certainly one of privacy, and we'll leave it there. But we certainly wish her all the best today, and happy birthday.
Thank you.
So I'll
to keep it secret.
Yeah. She's good at keeping secrets. So we can, I also, too, want to thank the Minister for the synopsis and the overview. I was spending, most of my night last night just catching up on where we are in Newfoundland and Labrador in comparison to other provinces. And I can assure you we have some great staff that are working in our long-term care sites, our personal care homes, and through our home support agencies taking care of our seniors. And I can assure you that we measure up. And we measure up simply because we've got great staff and we've got great oversight and real strong regulations in place. And of course, we can always, where there's room for improvements and lessons that we learn through all of this, we're more than willing to look at that, as we should. So thank you for that synopsis. So with that said, I will now turn it over to the media for media availability today.
Thank you, Premier. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press *1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
Thank you. All the evidence seems to point to either very little or no COVID-19 currently in the province. Dr. Fitzgerald, you said that on Monday, that people aren't showing up in hospital. We're not seeing any positive tests now in 20 days. So if we're making decisions based on scientific evidence, doesn't that show that the risk of disease is much lower now, and we could allow things like, for example, non-essential travel to allow for staycations?
So certainly the prevalence appears to be low in the province. I think we have to be careful when we're talking about non-essential travel. What we do know is that the more you move, the more the virus can move, and the more contacts that you have outside of your bubble, the greater chance of transmission of diseases. So while we think the prevalence is low, we don't think it's zero. We do have people coming into the province on a regular basis still through essential workers, people returning home. So we do still have that risk of importation. So the risk is not zero, and we do have to be careful when we're talking about non-essential travel, about non-essential anything really, because the more we move, the more chance the virus has to spread.
Mr. Haggie, you've been talking about long-term care situations here. We've been talking to many families who've reported that the isolation has caused loved ones to deteriorate, not just mentally, but physically as well. They're afraid that decline right now is a much bigger risk to their health than COVID is. Other places have started allowing, for example, outside visitations or finding lower-risk ways. Why aren't we doing that here?
I think the issue here is around a balance, and you make a good point that our prevalence on the face of it is low. We had decided at the beginning of the alert level 4 that we would wait for 2 incubation periods. That doesn't mean to say we've done nothing in this regard for 2 incubation periods. And I know Dr. Fitzgerald and the regional health authorities have been working on what would be a safe and sensible way to open up visitation for long-term care and personal care home recommendations for personal care homes. They operate slightly differently. Certainly, one of the things that we do have an advantage with is that we can look at other jurisdictions such as BC and New Brunswick and PEI and learn from their lessons. And again, there's always a rush for me too, but sometimes it's worth saying, well, yes, we'll give them a week and let's see how they do, because this is all new. There is no playbook, and the one message I get every day in my inbox on social media is, let's take it slow. Let's not run before we can walk, so we don't trip. So it is a balance, and I think you'll see changes around alert level 3 if things look good.
Speaking of alert level 3, now that we've seen some of the guidance for businesses, a lot of people are wondering about their own bubbles and what will change. What are the options that are under consideration in terms of allowing people to have a little more interaction when we hit alert level 3?
I'm sorry, Peter, I had difficulty hearing that last part. What are the options? And I missed what came after that.
What are the options being considered for alert level 3? What are the factors that are going into that decision making?
With regard to the bubble itself? And
in terms of expanding the interactions that people are allowed to have with others as we move into that alert level.
Right. So we certainly have been looking at that very closely, and we've been looking at not only what's happening elsewhere in the world and in the country, but we've also been looking at some modeling information to tell us, what could happen if we allowed this scenario versus that scenario. So we think we're very close to making some recommendations about how that will look in the near future.
Okay, thank you.
Our next questions today are Kellyanne Roberts of NTV News. Please go ahead.
So I'm wondering about an update on the tracking app and where we're at with that.
That's a good question, Kellyanne. Google and Apple have gone very much down the decentralized route here with the way they propose to have their interface structured. Apple released iOS 13.5 4 days ago, which in actual fact builds in the architecture that could be used for that. In discussions with our analytics team, it looks like we could be back end of June before we have something in the Apple Store and on Google Play.
Great. And with our case numbers so low here in Newfoundland and Labrador, is it still something government feels is necessary for residents to uptake on?
The uptake, from my point of view, is key, and this is not so much for our numbers now. This is to help us manage and augment traditional contact tracing when the next wave arrives.
How realistic is it to push for this app, though, knowing that for it to be effective, you need 60% of the province to download it? A wildly impressive app is considered that when it has a 6% download.
If we don't try, we'll never know.
Thank you, and happy birthday, Dr. Fitzgerald.
Thank you.
Our next questions today are from Tyler Dunn of VOCM News. Please go ahead.
Mr. Dunn, please press star 1 at this time. Thank you. Your line is now open.
Okay. How do you expect life will change for most residents when we enter the next alert level?
So I think in the next alert level, certainly, more businesses will be open, retail will be open. So I think there'll be a little bit more, people will be going out a little bit more and perhaps moving about a little bit more. There'll be some expansion with regard to bubbles and contacts. So I think, there may be some more socializing safely, but and at a distance at times. But I think there will be some more social connection, and I hope that that will help people to feel better. I hope as the weather gets better, we'll see more outdoor activities. Some things that have been traditionally indoors will maybe move outdoors, and I hope that we'll see people being a little more active and enjoying as much of the sunshine as we get. So those are, I think, the main differences that we'll see in Alert Level 3.
Thank you. And with our testing numbers low and Ontario announcing anyone who wants to get tested can, why have we not expanded ours further in order to have more accurate data for modeling purposes like what's happening on Friday?
So expanding testing at this point with a low prevalence won't necessarily give us more accurate data for modeling purposes. Ontario is in a very different position than we are. They have a lot more cases. So their prevalence is much higher, and certainly we know that testing is more accurate when your prevalence is higher. There's a lower risk of false positives, for sure, and a lower risk of false negatives. So, those are all things that we have to take into consideration. We're in a different situation, and you cannot just apply one blanket testing strategy across the country when you have some areas that have had no cases for many days and other areas that are seeing hundreds of new cases every day. So we're in different situations, so it would be foolhardy on our part right now to apply Ontario's testing strategy to Newfoundland and Labrador.
Okay, and with places opening up in the next alert level, some of them are going to need masks. Restaurants, for example, will it be the employer's responsibility to provide that PPE or the workers?
So for the PPE is part of a risk assessment that would have been done as people start to open up. If you're a restaurant owner, of course, you're recognizing that your job there would be, your responsibility there was to protect your customers as well as your staff. So part of the risk assessment that would have been done as you live with COVID in your business, as we live with COVID within our province, is to access enough personal protective equipment so that your staff and your clients can be kept safe. This is part of what reopening up our province is, and one of the requirements of those businesses that we've seen is just recently within the food, within the seafood processing sector. Those industries went and had to make some significant changes in their processing, and they put the PPE in place to protect their workers.
And the thing we have to remember with PPE is that it's actually our last line of our last line of protection when it comes to preventing the spread of COVID-19. So physical distancing is the most important thing that we do. And then if physical distancing is not possible, then we think about some engineering controls that may be able to be put in place so that you can prevent spread. For example, putting up plexiglass or things like that, like many of the grocery stores have done at this point. And then we think about administrative controls. So is there a way that you can change how your business operates? People coming in at different times, staggering their shifts, those sorts of things to reduce risk. And then if you try all of those things, or you go through all of those things, and you are not able to still reduce the risk significantly enough to make it safe, then you think about PPE. So, there are lots of things that have to be considered before we jump right to PPE.
Thank you, and happy birthday.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi.
Hi, Peter.
Many people are still asking about the idea of localized restrictions. You have a high and low risk area or region reopen at different stages, and it's something that's not only considered but even happening in some other jurisdictions. Is this something we would consider, Dr. Fitzgerald, and also how old are you?
So I think at the moment, our regions aren't significantly different enough that we need to consider that. Certainly it is something that, could be considered and has been considered up to this point. We haven't felt the need to do that as of yet, but obviously, yes, if there was significant differences between regions, that would be something we consider.
Okay. I'm curious that you had Dr. Rahman coming on a few days ago. He said you didn't see any reason or need for him to join the panel again. Why the change of heart?
Well, Dr. Rahman, we've always said that he could be available to to the panel, and at this particular point in time, I think it's he adds and lends some of his experience that he's had working with us behind the scenes in large part with all of this, and so there's really no change here. It was something that we've been thinking about for a while now, and given as we move closer to alert level 3 is just I think is great just to get the update from people like Dr. Rahman at this table, so he can speak directly to Newfoundlanders and Labradorians. And of course, Dr. Fitzgerald will be joining him there at that table as well. So it gives you just an opportunity for people that are watching and viewing the work that goes on sometimes behind the scenes and how decisions are being made. And as we move closer to alert level 3, just the added voice, the added experience based on the work that they're doing, and we can share that information with Newfoundlanders and Labradorians.
Okay. You're talking about seniors' homes, possibility of looking again at whether some restrictions will be lifted on that in the next alert level. I'm wondering whether that will include regular doctor visits, because apparently that's not happening at all right now.
My understanding, Peter, is that virtual visits have been available to anyone who needed them. Certainly in long-term care, in RHA facilities, there's been very little barrier to clinical personnel going in there, save for the constraints of concerns about bringing in COVID and is this necessary. There have been alternative ways of doing it. I can't speak to personal care homes. What I do know is that well over 3/4 of Canadians have actually been able to access their family doctor during the pandemic, according to recent polls carried out within the last week. Which is great, and I do know that we have had nearly 100,000 virtual consults performed, to our knowledge, through fee-for-service physicians. So I'm not sure of the foundation for that, but obviously if there are challenges with people accessing their family doctor, then I would certainly encourage the home on their behalf to facilitate that. The college have been very clear and very supportive about how doctors have to make themselves available, and my understanding is that it's actually been the exception rather than the rule when a doctor's office has been contacted that they can't get to make contact one way or another with their patient.
Our next questions are from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
I've been looking through the guidelines for personal services, and I see that face masks are recommended for clients. So I'm curious, does that prohibit facial services offered by salons?
Well, of course, I guess if we just think about it from a logistical point of view and some of the services that would be provided, that it's important that, if a face mask is something that's suggested in that particular case, it would be very difficult to perform such services. So right now the responsibility then would be through the risk assessment that I've mentioned earlier. So how safe is it to offer those services? So if face masks are required, that's part of the recommendation. Well, indeed, we have to find a way, if at all possible, to offer that service. I know yesterday, as an example, I took the opportunity that I mentioned about a week or so ago, and one of the things that was required, when I went to donate blood yesterday, was you wear face masks. So that was provided to me as I went to make that donation. No different than people, if they went to access the services that was required, well, that would be provided to them as well. But, we also know that if you cannot practice, as Dr. Fitzgerald just mentioned, if you're into a situation publicly that you cannot practice what's been the standard measures, say, physical distancing, proper hand washing, not touching your face, and so on, that, the PPE and things like face masks, well, they seem to be a thing of last resort, but recommended in many cases.
Thank you. And I was wondering, could there be any funds or assistance coming to businesses that have had to make the investments in order to be able to safely reopen again under these restrictions?
Yeah, that's a good question, and we've been having some discussions, and some of the work that we've done this week, and some $25 million that's been put in place, for the tourism industry, and we supported businesses as deferral of fees and waivers and so on. Some of the announcements that we've been able to roll out in recent days. So one of the things that's been under consideration in some cases, there's some startup costs for businesses, and how we handle that, because these are decisions of government. So these are some of the things that we're looking at. The costs in some cases are not really exorbitant, but yet people are anxious to get back into business. But we want to work with this business community, and we know that many of them have been impacted. Many of them have been having some hardship right now. So if there's ways that we can support them in small ways, like you've just mentioned, we want to work and see how we can actually roll out such a program.
Thank you. And the other day, the federal government announced it had struck a deal with GM for 10 million face masks. Minister, do you have any idea of how many of that order could be going to this province, if any?
No, we do have a pro rata share of any federal purchase, and we can access over and above that share if we find ourselves in an acute clinical need. So that's a discussion for procurement ministers, and I believe they met yesterday or the day before. I haven't had a briefing yet from my staff as to whether or not, and indeed when those masks would be available. There's a deal, but I don't know of any delivery date.
Thank you.
Thank you. We're going to take two questions from each reporter before we conclude today's briefing. So first up, we have Peter Cowan of CBC News. Please go ahead.
We're going to get an update on the medical modeling on Friday, but Premier, I'm wondering whether or not you've done any economic modeling about the impact of these measures that are in place and what lifting them could or could not mean for the economy.
So right now, the officials at Department of Health are finalizing some of the changes that were impacted based on our fiscal year 2019-2020. We should be in a situation now within a few days to be able to roll this out to the people of our province and update on what the last year's physical update would have looked like. That would have been information that would have been provided in as we would have been getting ready for the budget for this year. So we get that information out. So there's always there's work being done within the department also in monitoring some of the federal initiatives that's been put in place. Added to that, some of the provincial initiatives that have been put in place. I noticed, I think it was last week up until the end of March, what we saw were some, sales statistics that were compared Newfoundland and Labrador to the national statistics. The national statistics showed by the end of March, these were the latest ones that we've seen, that the sales, for the country were down on average of about 10.9%. In that information, the analysis was done on Newfoundland and Labrador, and Newfoundland and Labrador was down 7.9%. Or 7.8%. So we're finding a way within our province to be about 3% better than the national average in people getting out and accessing services. So that would have been the latest national statistics that I would have seen. But we are monitoring, and we know there's been a severe impact on our economy, but mostly around the impact of oil and gas and some industries. Some industries have performed quite well through this. Some of our grocery stores, beverage, and some other industries have had some difficulty. So this is part of the analysis that we're doing as we add additional supports over the next weeks on how we can help our economy rebound.
Those statistics, though, we're looking at what has happened. Are you actually doing any modeling, though, looking at what will happen? For example, if you make a decision to keep stores closed for an extra month, what impact that'll have on the economy, and do you have any of that data that you're factoring in as you're making these decisions?
Well, one of the things that we can easily factor in, Peter, as you know, and part of the press conference that we had yesterday is the impact of the oil and gas industry within our province. We know we're talking about hundreds of millions of dollars here. And most of this is related to the pandemic and where we're seeing overproduction in other areas within the world, around the world. So, and demand, of course, is lower there as well. So some industries, it's not all the same. Interesting enough, as I just mentioned, some industries have done okay and have performed quite well during the pandemic, but others, you think about a retailer or something in the clothing retailer or some of the other malls and so on. Most of those stores have been hit extremely hard with little or no revenue at all. So it's very difficult to forecast this. The fishing industry, the mining industry has been doing okay throughout all of this, even though markets have changed considerably. But we're trying to drill into this. Let's face it, we're only literally a few weeks into this already, so it's very difficult to determine. And as we, big focus for us right now is as we start to reopen the economy, making sure that people are ready to go back to work. But there's been quite a few federal programs that have put money into the pockets of Newfoundlanders and Labradorians as well that will help bridge this gap. So hopefully some of this money will find its way into the retail sector as we begin to open up.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thanks. Continuing with the app here, the federal government has announced that they're working on a contact tracing app. The only other province that has rolled one out is Alberta. I'm just curious as to why we're working on one if the federal government's already announced they're working on one.
Yeah, that's a good question, Kellyanne, because, you know, Alberta has rolled one out, and one of the things that gives us a chance and gives everyone a chance to analyze what happened in Alberta. They've had some success, although that it's been limited based on the information that's been shared with us. I think they reached a peak at 1.11% of their population, and simply because of the mechanism in that particular case there, as you know, it has to be a convenience for those to adapt and to add this to your smartphone or your device. As you mentioned prior to this, the uptake on what percentage will be is a critical component of this. And simply because it was a drain on the battery on their smartphones, some people start taking that off. So these are all factors that are being considered, as the minister mentioned earlier, as an app that gets put in place. For it to be useful, it has to be convenient. I know New Brunswick is at a different stage as well. But the big question that's coming nationally around proper contact tracing is it is a centralized or decentralized. Decentralized meaning that you use it, you know, in your particular province, and how that the information is being shared. For it to work most effectively, it would need to be connected for every province, for people as they move around, as you open up the country. So far right now, I don't think that's where we will see it going. It will almost be seen as a decentralized device for now, but recognizing this is voluntary, and it will always be voluntary. This is not a mandatory measure, but it's an important tool. But keep in mind, without this app, we can still do contact tracing in this province. I would not want anybody to believe that we do not have the capability to do proper contact tracing without an app. We can, and we've done it in the past. This would just be a nice little additional tool that we would have.
Thanks. And we're hearing compensation grants for daycares ends on May 30th. That's just 3 days away. However, these daycares are still required to work at 70% capacity, including staff and children. This will have a significant impact on their bottom line. Will government be offering any help?
Yeah, so far this is working its way. There's an analysis being done now. There's no decisions are made on the cancellation of this from May the 31st.
Thank you.
Our next questions are from Tyler Dunn of the OCM News. Please go ahead.
Thank you. Can you go over the recently announced changes to public parks, and what should people know if they plan on visiting them?
So I think some of those decisions were made not by public health. They are actually made by the municipalities in the different towns. So, but I understand that some of them have recently lifted some of the walk-through only measures. So I think that's a good thing. It means that people can go and enjoy their parks the way that they have. You know, we know that, excuse me, outside there's a lower risk of transmission than indoors. However, that's not to say that it can't be transmitted outside. It can be. So we still recommend physically distancing. So if you're going to the park in your bubble, we would recommend that your bubble stays together and they stay away from other bubbles, so that you know, we have that physical distancing in place. We certainly wouldn't want to see a situation like was seen in Toronto over the past weekend. That is not really where we want to go with this. It's about, if you're going out, be respectful to other people, be respectful to other people's bubbles, and physically distance so that we can all stay safe.
Okay, thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi. The Liquor Express stores, they've experienced about a 90% jump in sales since the health orders were put in place, which means more traffic is going into these smaller spaces. In light of that, are liquor stores, are you aware that liquor stores may return to in-store service either on June 8th or at some point afterwards?
That is not information that I would have right now. Moving to alert level 3 if NLC stores would be open up to regular traffic or not. It's not a discussion that I've been part of, but you know, likewise, as we open up the economy, as I said so many times, and we've all said that when you look to reopen any premise, you must be able to do it in a safe way with a risk assessment that would be done, making sure that PPE, is, if it's required, will be there, making sure that we have the proper hygiene and we take those measures that have been put in place by public health. So from the Newfoundland Liquor Corporation, the access to those stores, that's not something that I've been part of, but it's something I'm sure that will be considered as we move into alert level 3 and beyond.
Okay. The other question I wanted to ask Dr. Haggie was, you've explained the stark differences between long-term care here and in Ontario and some other places. Were there any lessons that you could glean from the recent report in Ontario?
Peter, I've only speed read it. I think that analysis I know is underway. I've just spoken to 2 staff members in the department about looking at that in more detail. I think we need to take a few days to digest it and make sure that we find any relevant nuggets that we can use to help. So the answer is we're not quite there yet. We need a bit of time just to digest it.
Thank you.
And our final questions today are from Elizabeth Witten of All Newfoundland Labrador. Please go ahead.
Thank you. Dr. Fitzgerald, can you explain some of the considerations that went into making some of the guidelines around personal service businesses?
With any of these businesses reopening, we had to consider, we had to ask people to consider how close is your contact with your clients. So, there are some places where the contacts you can physically distance. There are some of these personal services where that's not possible, and so that will determine the guidance that we make. So if you're going to be up close, obviously, and there's no way to put in any kind of physical distancing or any of these other measures that would be protective, then personal wearing a non-medical mask to prevent spread would be important. If there are ways that you can put things in place, then you would do that. So we've provided guidance as to how, what would have to be in place for businesses to operate safely, and then the businesses have to take that guidance and apply it to their own situation, because every business is different, and certainly public health is not an expert in all of these fields, and we really have to supply the guidance and leave it to the business owners to be able to apply that to their situation.
Thank you. And I don't see any mention on the list about occupancy limits for personal service stores for allowing customers in at a certain number at a time. So I was wondering, was that just not a concern, or am I just not reading it closely enough?
So I think many of these places, they see one person at a time, and they tend to be individualized appointments. We did make recommendations for spacing and to ensure physical distancing if there are people in a waiting room, and obviously if the waiting room can't accommodate that, then the people can't be, if they can't be physically distanced in the waiting room, then some other alternative way of waiting for the appointment has to happen, such as in a car, waiting outside in your car or that sort of thing. So there's no specific occupancy recommendations. It's really about the ability of the business to maintain the physical distancing in those situations, such as waiting rooms and things like that.
Thank you.
Thank you very much for tuning in. The time for questions has ended. Please join us again on Friday, May 29th at 2 p.m., 1:30 in most of Labrador. Tomorrow we will provide our update in the form of a news release. Thanks and have a great evening.